All right, we got some very bizarre headline from CNN. So let's read together. One important and dangerous way the Omicron surge is different than previous surges in the U.S. And we've got something I don't want to see. I'm interested in what CNN is going to say because I've been doing a lot of media criticism when it comes to the handling of this whole surge in mainstream media. So let's see what they've got to say. The U.S. kicked off 2022 amid a massive COVID-19 case spike driven by highly contagious Omicron variant that some experts warn will be different than any other time in the pandemic. What we have to understand is that our health system is at a very different place now, than we were in previous surges. Professor of Emergency Medicine Dr. Esther Chu told CNN on Saturday, "We have extremely high numbers of just lost healthcare workers. We've lost at least 20% of our healthcare workforce, probably more." So folks, that's one of the big problems here. Is again, we're thinking, oh, we're in year 3, so we should have been training. We should have done like a massive, like, multi-trillion-dollar package that involves like free education for anyone that wants to be a nurse or a doctor. That's what we should have done, but we didn't. So here we are. This strain is so infectious, Chu added, that I think all of us know many, many colleagues who are currently infected or have symptoms or are under quarantine. There are some people in my family that have it. And that's no good, folks. It's bad news. The high number of healthcare staff out with the virus will also have an impact on Americans' doctors' appointments and could make for dangerous circumstances. I thought that said circumcision for a second there. When people are hospitalized with COVID-19, Dr. Peter Hoots, Dean of Baylor University, blah, blah, blah. All right. Yeah, I mean, this is a big problem. But again, folks, the new mayor of New York City declared victory. He said that New York City is back. Remember that? The governor of New York said we got to get back in the offices. I don't live in New York. I live in North Carolina. But still, like, you'd think, oh, New York, that's a liberal Democrat state, right? Like, they pay attention to science, right? I got to get some blood work done pretty soon here. So I got to get that set up before it's too late. There's a different type of 1-2 punch. People going into the hospitals and all the healthcare workers are out of the workforce, he told CNN. But the latest variant isn't just shrinking healthcare staff numbers. As the virus spreads like wildfire across American communities, staffing problems are already altering parts of daily life. Plagued with staffing issues, New York City's Metropolitan Transportation Authority announced last week several subway lines were suspended. There's also been situations where several Walmarts in the New Jersey area that I saw were out of business. So so imagine, okay, the Walmart closest to you is gone. Like, they're shut down. So then you go to the second one that's closest to you. That one's shut down. That's the situation that's going on somewhere in New Jersey. And in the middle of a busy holiday season, thousands of flights have been canceled. Again, if you're flying to go somewhere, because it's the holidays, I hope your plane fucking crashes. We're seeing a surge in patients again, unprecedented in this pandemic. What's coming for the rest of the country could be very serious, and they need to be prepared. Vast majority of patients still the unvaccinated. Unvaccinated Americans continue to drive COVID hospitalizations in the latest surge, much like the summer surge when the Delta variant was ravaging parts of the country. Despite a year of calls from public health experts to get vaccinated and now boosted, only about 62% of the U.S. population is fully vaccinated. What does fully vaccinated mean? Does that mean you only have 2 shots? Well, if a booster is required to be as efficient as possible, then 2 shots is not fully vaccinated. I'm just saying, that's logic. And about 33.4% of those who are fully vaccinated have received their booster doses. So we only have about 30% fully vaccinated in this country. That's how I read it. If you're unvaccinated, that's the group still at the highest risk. Dr. William Schaffner, a professor at Vanderbilt University Medical Center, told CNN Saturday, The adults that are being admitted to my institution, the vast majority, continue to be unvaccinated. 3 large Georgia school districts return to remote classes. All right, anyway, so, yeah, we're fucked, folks. I'm glad I don't have any kids. I'm glad that I don't have a job where I have to leave the house. We're fucked. We're fucked. We're fucked, folks. I don't know how else to tell it to you. We're fucked. And not in the good dick way. I have to add that on there. It's not good.